So my name is Perri Tutelman, and I'm a PhD candidate in clinical psychology at Dalhousie University in Halifax, Nova Scotia. And my research is focused on understanding the experience of pain in children with cancer using both qualitative, primarily phenomenological, as well as experimental pain methods. And I'm really thrilled to have had this opportunity to co-guest edit this special issue with Fiona Webster and the editor-in-chief of the journal, Dr. Joel Katz. And so let's jump into some of these controversies. Fiona and I discuss some of these current issues and our thoughts on them in the introductory commentary to the special issue. And just due to time limitations, I won't be able to get into them, all of them, or into the necessary depth. But I encourage you to check out the commentary for more information, and we're happy to chat more after. Before I jump in, I also want to note that there is broader debate in the qualitative literature about some of these issues. So the discussion on the following slides really represents both mine and Fiona's views, but I do want to acknowledge that there are, others as well. So I wanted to start my talk today with one of the factors that led to the development of the special issue. So as a young scientist new to qualitative methods, I've often felt discouraged and frustrated by reviews that have come back on qualitative papers that I've submitted. Because on one hand, I was being taught that well-done qualitative work meant rich description and deep interpretation, and that there was no one universal truth to qualitative, or to experience, as Fiona was saying. Yet on the other hand, I was receiving reviewer comments and editorial decisions based on these comments, flagging the interpretive nature of the work as a limitation, and also kind of talking about how in order to be valid, theme development had to show inter-rater reliability and so forth. And so this was really disheartening, and I knew I wasn't alone in these frustrations. So over the course of the last few years in my learning and exploration of qualitative research, it's become increasingly clear to me that qualitative and quantitative researchers are seeing things differently when it comes to the evaluation of research quality. The typical approach to assessing research quality focuses primarily on procedural related criteria. So that is, how well was the research carried out? How well did the authors execute the scientific method? And the problem is that the sole focus on methods and the correctness of procedures oversimplifies this iterative and interpretive nature of qualitative research and distracts from a key indicator of qualitative research quality, which is the theoretical or conceptual insight that an analysis can provide. And this is what's referred to as more substantive-centered criteria. And so don't get me wrong, I'm not saying that methodological rigor isn't important, but what I'm saying is that we need to move away from using procedural-centered criteria as a sole indicator of qualitative research quality, and instead use it to guide our understanding of the substantive criteria or the analytic content. So some of the most common procedural related criteria that are often misapplied to the assessment of qualitative research quality are things like small sample sizes, lack of generalizability, and that qualitative results are only valid if they reach saturation. When in fact, small sample sizes aren't a weakness of qualitative research, but rather a core characteristic of many methodologies, given that the data are intended to provide rich exploration. And second, generalizability isn't a goal nor an objective of qualitative research. I leave aside the broader debate regarding context effects that have been identified in behavioral research more widely. But coming back to qualitative research, qualitative researchers generally rely on the concept of transferability instead. And that is to describe how their findings can generate theoretical or conceptual insights applied more broadly beyond their own study. And with saturation, the answer is really that it depends. Saturation, which is the idea that you've reached the volume of participants or analysis where no new information is generated, is a key component of some qualitative approaches like grounded theory, but it's unhelpful, unachievable, and in direct opposition to others like phenomenology or reflexive thematic analysis. So using it as a measure of quality across all types of qualitative studies, as is often done by non-qualitative experts, is problematic. So in sum, we really need to start thinking about things differently when it comes to qualitative research in pain. Using procedural related criteria alone, such as sample size and lack of generalizability, to judge the quality of a qualitative study disregards the substantive contributions that a study can provide. And so we need to start evaluating qualitative research in its own right for what it can provide and not for what it can't, by adopting a more substantive focused approach. And I think this is going to be crucial to help us retain high quality qualitative research in pain. And I think to do this, we need more training opportunities for those interested in engaging in these methods, and also to increase the number of journal reviewers and editors who are competent and knowledgeable in these substantive issues related to qualitative methods. So to this end, Fiona and I dreamt up the idea of the Canadian Journal of Pain special issue on qualitative research in pain to highlight novel, innovative, and high quality qualitative research that's being conducted in the field. And I'm immensely grateful to Dr. Joel Katz, the editor-in-chief of Canadian Journal of Pain, for his support of this idea and this more substantive approach to the assessment of qualitative research. And so the issue, which is now published, is comprised of 7 empirical qualitative studies in pain, 3 of which you'll be hearing about today. And without further ado, I'm going to introduce the first speaker.